let's start with today's class. Today we're doing those preschoolers, school age, and adolescent children. Remember, their growth slows down and it's more stair step at this point, but they still continue to grow. And talk some more about that. So let's go ahead and start with our PowerPoint. I changed the color of the one that you got just because the blue was driving my eyes nuts. So it's still the same PowerPoint. It's just different color, okay? But if you want, I can send you the one without the colors, and I'll attach that to your recording this evening when I do attach your recording for the class today, okay? So let's start out chapter 18. We're going to start out with the preschool children. This is your ages up to 6, okay? This is, these children are that in between that awkward toddler and then that school age child who's able to express themselves more verbally and physically. They're more active. So it's that in between age. This is my grandson, age 6 right now, and he's at the end of this, and I'm watching all these things going on. So you should double that 1-year-old weight by 5 years old. Now, my little grandson was 21 pounds at 1 years old. By 5, I think he was 40 pounds, and he sat there for a long time. I think he's up to 48 pounds, but he's always been a little peanut. But it does sort of fit into these things. These 3-year-old children, at this point, they're going to be 4 times their birth weight. They say about 2.5. Books will be different. 2.5 to 3 years old, they should have quadrupled their birth weight. So by 3, they should be born at 7 pounds. They should be about 28 pounds. And it's pretty close to what they say. They're getting taller, they're getting thinner, they're less pudgy, they're less clumsy, they're more control of their muscles. All of their baby teeth are in, all those primary teeth are in there. And now we know, are they right-handed or left-handed? I mean, for years, we're like, okay, he likes to do things with his left hand, but he throws the ball with his hand. What is he going to be? Well, my grandson is unofficially a lefty, and he does everything with left hand, but he still uses his right hand with a lot of stuff. And again, we're getting more and more adept in everything that we do. All right, now let's go into some of these, theorists. One of the people who did one of the discussion questions this week was all about Piaget and Erikson. And I think the person who described it the most was Brianna. Very simplistically, she said that when you talk about Erikson, it's more about physical needs. What the physical, what they want to do, experiment with. But Piaget is all about using the mind and building on the mind so that they can continue to do more and more, because now they're starting to think about what they do. And I think that was so perfect in the way that she had said that. So good job there, Brianna. I really said, yes, right on point. So that was great. So again, Piaget, we're starting with these different, phases that we call. It's more preconceptual, it goes intuitive. But basically what they're doing is they're learning how to think and then use what they're thinking in order to take it and learn more about what they're doing. It could be that little baby initially who took the rattle and it shook and he went, oh, look at that. It makes a noise or like that. Or taking the finger and putting it in their mouth accidentally and realizing they like it. Or as they get older, that 2-year-old who knows how to do things to get mommy and daddy's attention, right? It could be, yelling and screaming so they come checking you. What's the matter? What's going on? Those things. It's also now playing with toys, a broomstick, making it into a horsey, all of these things. They like to have their animals, they play with them. My little grandson had this little giraffe, this little stuffy toy, and he called it Mr. Puppy. Why? I don't know. But that Mr. Puppy used to do so many things. It used to jump, it used to run with them, and he make them, get on cars and drive them around. And it's all these things that they love to do. Now, when they get a little bit older, 4 to 7, it start more about being more logical. Again, we're taking this pretend play. They're magical thinking at this point. I think that really describes Piaget. It's like they're magical and they start thinking what they can do with toys and themselves. Again, it is that arms is the airplane and the stick is the sword or the horsey that they're riding. And it's starting to using those things, again, imaginative. Now, culture. You don't think really culture has a lot that you need to think about, but it really does as a nurse. Looking at a family and their culture, my culture is different than your culture than somebody else. I was brought up in a very protected environment, and I didn't know different cultures. The area where I was from, didn't have, Hispanic or Haitian or European or anything. So I moved to Miami and now I am, with this flux of all these cultures. I mean, my children's father's Cuban, so I had to learn the Cuban culture. Working into the hospitals, I've had to learn all the other cultures on how to respect them and also to put that into that nursing care, okay? We know that, the families are the ones that model the way they think, the way they speak, and all of those things. And what their values are. Are they that please and thank you child, or that fight that, or is that child who just give me, give me? It's all part of culture, which comes from the family. Because remember, this is all about the family who's bringing a child up, and the child learns from that family. Now, we can have delays, we can have problems. It could be due to something physical that happens, or it could be something genetic that they were born with. A lot of times you'll see hearing problems. They can't hear, so how can they speak? How can they express? Or how can they do if they can't hear what you want, right? So that could be part of it. Or what about an infant born premature? And then at birth, they're so small, their brains are very fragile. And sometimes they have what we call interventricular hemorrhages because their vessels are so fragile, and loud noises or sometimes just abrupt movement can make the brains burst a little bit of blood into their ventricle in there, and it could cause some brain damage. So this could happen. Now, psychological, where there's different things that can happen. As we get older, we might see anxiety disorders or attention deficit hyperactivity. You cannot concentrate at all. You go from one task to another task to another task, and they can't complete one. These are your children who might be disruptive in school. You might see a child with autism, and we don't really diagnose autistic children till about 2 years old. And the reason why we wait is because we want them to try to go through the growth and development and understand. Now, we might have a think maybe, and if we see them behind in their growth and development, we know earlier interventions going to be given to them, as in speech, occupational, physical therapy, to try to catch them up so they can be where the other kids are. And if a kid is autistic, they're not going to catch up as quickly, but they can make up a lot of room where they can be as the best as they can be. We know sometimes just having meningitis, encephalitis can cause problems, with delays. You talk about drugs, poverty, malnutrition. I mean, what did I tell you about nutrition, nutrition, nutrition? If you don't feed the brain or put gas in the car, it's not going to move, right? If you don't feed the body good nutrition, that child is not going to be able to think properly. The central nervous system is not going to be able to function properly. And these kids' motor and fine motor skills, gross motor skills are all going to be delayed, all because of nutrition. A part of being these delays can be that even the understanding of, people talking to them, what does those things mean? And one of the things that causes frustration is their inability to be able to express their needs. We know that preschoolers in themselves have a hard time expressing their needs. They don't have all the words. Now, they understand a lot of it, but they can't express what they're trying to say. They don't know the words yet. Bedtime. Bedtime at this age is pretty hard sometimes. It's hard to get the kid to go to bed, read them a story and say goodnight because they want to kiss daddy again. They want to hug the dog. They need to go to the bathroom. They want another glass of water. They want another hug. Give me another kiss. Can I read another book? If they want to, prolong that bedtime because they might miss something, right? The one thing about bedtime is you need to have a ritual. As in, you stop, these children are going to be potty trained or close to potty trained at age 3. So you're going to watch that fluid intake before bedtime. You're going to do things that are calming, not just out running around in the backyard and say, okay, let's get ready for bed now. It's not going to happen. Have them calmer before it. Maybe watch a movie before or a show or color. Just that, whatever that routine is. Let's go take your bath. Let's get your jammies on. Let's go read a book. Let me give you a hug. Good night. Now play. What do children do from birth? They play. What do we still do if we have a chance? We play with whatever. Play could be just watching TV for, as you get older, but play is very important. Now, toddlers, the big thing they love to do is parallel play. Because remember, they're me, mine. So they'll be playing a child here, a child here. They're going to play next to each other, but they're not even going to share toys. Because remember, that's my toy. Give me. And they'll be ripping out of each other's hands, right? That's what toddlers do. Well, as we get older, they're going to start to be able to share more. And what they do is they start associative play. Now, associative play, they're playing with the same things, but they're not working to create or somebody to win the game, okay? It's not like, let's play together and make a house. No, they're both doing their own things, but they're both using blocks together. Now, what is it if they're playing together and they make the house together? That is called cooperative play. I also like to say that could be a board game. That could be as they get older, like playing checkers or playing something where somebody wins. So it could be building a sandcastle and they build the castle together. That's cooperative play. They're doing it together. It could be 2 kids, 4 kids, 6 kids, as long as they're working for one goal. They need to start helping with household chores. I mean, Christian loves going and get me my laundry. He loves putting it in the washer and dryer. He likes taking it out of the dryer and bringing it to where I fold it. And that's part of his chore, that and picking up his clothes. So putting his dishes in the sink. These are things you need to start. So they are part of the family. Now, they also are afraid of pain. They're afraid of, hurting themselves, losing a finger, these sort of things. Absolutely normal. They're just getting a fear of those things. Again, they are angry when others try to take what they believe is theirs. Again, they still think that it's theirs, they need it, but you can make sense of it with this child. Toddler, no, they're going to mind, take it, and that's it. And basically, they're probably going to have to go on some timeout, right? Because they're not listening. But a preschooler will. Now, a 4-year-old can use scissors and shoelaces. So their fine motor skills are coming up. Look at their vocabulary now. It's 1,500 words. They love to make things. They like to cut things with scissors. They like Scotch tape. They like to stick things on stuff. They like to paint. They like to all this stuff. They prefer to use those things. I mean, for my grandson's 4-year-old Halloween costume, we took a cardboard box and put stickers on it, cardboard papers, and we made it into a race car. And the kid loved it because he made it and then he picked his numbers for the car. And they love those sort of things. They're starting to understand stories. that are saying something that, you know, something happens to the bunny rabbit or something happens to the kid. Loves those things. But they're also into concept of death, and they're really afraid of death. And they're starting to talk about those things. 5-year-old is now more responsible and less dependent on the parents for bathing and dressing. You can say, go take a bath. They'll take their clothes off, put it in the dirty laundry. They'll go fill up the tub. I mean, you're going to go in and check to make sure all the areas are clean, but you know, they're more independent doing those things. They're asking questions like crazy. They're curious children. They can ride a bike. They can use tools as a hammer. I mean, my husband taught little Christian how to take a little screwdriver and take off the battery backs of toys with a tiny screwdriver. Go get the batteries, how to put them back in. He loves to do those things. He likes to be more independent that way. They are unbelievable with computer games and TVs. This kid knows how to use YouTube on my phone. He could do more things on my iPhone than I could ever think of. And that was at 5 years old. He wants to be a YouTuber when he grows up, okay? So children do need limits for their behavior, okay? So one of the things is, how do you take a kid whose behavior's not doing well, they're not listening well, how can you have them to understand it? Well, this is the timeout. This is when we say 1 minute per age. So a 3-year-old would have 3 minutes, a 5-year-old would have 5 minutes, and even a 10-year-old would have 10 minutes, okay? These are things that we use, and we tell them that this is what you did wrong. This is why you're on time out. And the clock will start when you settle down, be quiet, and stop crying. And usually they'll listen because they want it to get over with quick enough. Now, rewards shouldn't be bribes. The reward should be is, you know, you told him that no more apple juice because you've already had 2 today. You know, you want him to have more water. But let's say he took his clothes, brought it in, and put it in the drawers because he knows how to do that. Or he helped you empty the table of the dishes or something. And you say, you know, you were so good. Let's give you another apple juice. And they go, wow, that's awesome. So it does promote good behavior, doesn't it? Thumb sucking. Well, we know that all of a sudden the baby finds it and likes it, right? How does infants, you know, explore the world? And even children, it's always the mouth. I mean, even 5, 6, and older kids, pencils, pens in the mouth at school, fingers, everything. The shirt, sucking on the shirt. One of the things, they do all this stuff because they're exploring that. It doesn't have a detrimental effect as long as you get that finger out of the mouth before permanent teeth come in. My daughter was this finger backwards. So you could see those front teeth could have been pushed out. We did get her to stop that finger before those front teeth came in, or they're going to be pushed out, and what's going to happen? They're going to need braces at that point. So one of the things that we try to teach them is, wow, you didn't suck your thumb, and I know how hard that was. Good job. And again, maybe, come on, let's go get some ice cream together. Or, you know, I got a special candy for you today, or whatever it is. Or how about you and me go to the park together? Stuff like that is a reward, and they love it. Now, one thing about children, when they have stress, they're going to do things that calm themselves down. And it's usually to go to being regressed. They go regression. Well, what does that mean? Well, the kid who stopped thumb sucking, whose dog died, or something happened traumatic in their life, they might go back to sucking that thumb for that time. Just make sure that it doesn't go on again so that it will mess up those permanent teeth. Now, bedwetting. You have children who've never been dry, then you have the secondary where bedwetting starts after they have been dry for over a year. And you see it in boys more than girls. Now, It could be just, that stress going on, or it could be something organic. Now, always rule out that urinary tract infection, because if you have an infection, you're going to have that urgency, right? Now, diabetes, what are the signs and symptoms of diabetes? Polydipsia, polyuria, just like diabetes insipidus, polydipsia, polyuria. Drink a lot, urinate a lot. So we have to rule that out. Another thing is they might have seizures. And seizure doesn't mean the arms and legs flailing up and down. It could be just a blank stare that could cause those things. Could be something in the urinary tract, which I've already mentioned, or it could be some sort of sleep disorder. Sometimes they have these panic attacks at night in their sleep, which could cause bedwetting. So as a nurse, what are we going to look at? Parent tells you that the child, was secondary, was dry for a year and now started to get wet. What are we going to do? Well, we're going to get some information. When does this happen? How many times a week? Are they peeing all day long? And if they're peeing, what does the pee look like, right? Is it just a little dribble, or is it really coming out normally? Is it painful? Are they drinking before they go to bed? And is there anybody in that house that has a problem with bedwetting? We know, as I said, stress is a big thing. And medications, there are medications that make you urinate, right? Now, when did they get their potty training done? So what do we need to do? Well, we need to have this child partake in this program of stopping them from bedwetting. So what do we do? Well, liquid should be limited after dinner, and make sure they go to pee before they go to bed. Now, something very personal, but I bedwetted till I was about 8 years old or something about there. And I remember my parents, before they went to bed, would take me out of bed and sit me on that toilet and make me pee before they went to bed. And that did help me stop urinating. I didn't have any problems. It was just, who knows? I had 6 brothers. Maybe they were picking on me. I don't know. So there are options that you could do. Well, I literally hypnosed myself. I told myself, if I thought about this certain thing, and if I got through this whole little thing in my head, I wasn't going to urinate in bed that night. And I wouldn't. So it can happen. And that behavior modification, and today they do have medication that can help stop that bedwetting. Again, what about those bladder training exercises? Make your bladder bigger so that it can hold that whatever urine during the night. So preschool. Preschool loves structured activities, and those activities help children work together so they cooperate with each other and they can cope with each other's whatever they're doing, right? And what if a kid is doing good at it? Well, even if they're not, you are going to make sure that you find something they're good at and praise them. And that gives self-confidence and good self-esteem. Now, daily care. What should they do every day? Well, we know they should brush their teeth, right? That should be morning and night, and we'll go into that more. But they still need to bathe every day. They don't have to wash their hair every day, but they say at least twice a week. They say their clothing should not be tight and restrictive. I mean, think about these young girls and wearing these tights. Sometimes it restricts themselves and they get urinary tract infections from that. So it should be looser fitting, okay? And make sure you can wash it, because kids love to get dirty. I mean, my little Christian comes home from school with dirt and everything, food on the front of his shirt. He can't wear a white shirt because it will be covered. So make sure we can wash them. And of course, good shoes. So accident prevention. I mean, what's the most common thing? The most common injuries are unintentional injuries, which means kids fall, hurt, they do things that they didn't mean to, but it happens, right? Now, car safety, these children, front seating, front sit in the rear seat and facing forward now, right? After they're 2 years old, they should be like that. And they should maintain being in a car seat. And they say that they can go to booster about 8 years old. Now, burns, we're cooking all the time, many people, and making sure the handles are in because they will pull on them. And again, keep everything that's poisonous away from their child. Put those cabinet locks on all of those cleaning stuff underneath the sinks, right? Little Christian is the most social, friendly kid there is, but he has to understand about the dangers of strangers, right? Stranger danger, as we call it, making sure they don't go anywhere with anybody that they don't know. And it's something that we have to continually talk about. They do need us to be watching them closely because they still make mistakes and do things that could cause harm. Now, preschoolers love imaginary playmates. Absolutely normal for them. Now, if they're school age with an imaginary playmate, something's wrong. But a preschooler, this is absolutely normal. And it's because they have somebody to play with all the time. It's that imaginary person. So growth and development. Again, these kids are going to be growing. They're going to be getting more verbal. They can express themselves good. And, as they get older, again, we're going to keep their attitudes, as I call them, in line, and the use of timeouts, and maybe just, sit down and let's turn off the TV for 2 minutes. Whatever it needs to be in order to show the child how to act. Because again, they're going to be going to school and they're going to be with teachers, and they're not going to learn if they can't listen to the rules, right? Now, hospitalization. Now, one of your discussion questions is going to be all about separation anxiety, okay? Protest, despair, detachment, and aggression. And those are your 4 stages of it. And what does this mean? Well, these kids are used to being at home with you or going to daycare or family members, places where they know. And then all of a sudden, they get sick, they got to go in a hospital for whatever reason. Now, parents can't always be with that child 24 hours a day. They have to work, they have other children. So a lot of times these kids have to be left alone, and it causes separation anxiety, okay? So at first they're going to scream and yell, and then they're going to be crying, and then they're going to be quiet sitting there in the corner. And then they're going to say, okay, whatever, and then they're going to be sucking their finger because they're stressed, right? These are all the stages of it. So I want to see more about that when you do your discussion questions. It's a really good exercise. So nursing assessments when we're looking at a child. When we look at a child, there's 2 things I always look at, especially if they're coming in where I was working in the emergency room. Are they well appearing or are they sick appearing? Well, looking at healthy children, what do you look at? Well, how do they play? Do they go find toys and run to it and say, play with it? Or mommy holds them, brings them over and they sit down and play? Are they in the group or are they by themselves? And are they there talking to themselves or the other children? And again, how long can they sit there and play? How can they keep that attention span? Now, the Denver developmental screening tool has nothing to do, with, their developmental stage, okay? It doesn't tell you what you need to do, but what it tells you, what is their social, motor, and language skills? What do you need to maybe institute? You might have to give speech therapy, make them better, talk more. It could be physical or occupational therapy, which helps them assess that. So Denver screening tool. All right, let's go into your school age child. These are chapter 19. In general, their ages 6 to 12. And now they're starting to want to know. They understand, they want fact more than their fantasy, but you know that they do love like girls with witches and fairies and princesses, and they love those sort of things. But it's not as much as your preschoolers, right? These children are now in school, they're in kindergarten and first grade, and now they're starting to get best friends out of the family or the family relatives. And the kid's going to come home and talk about Sebastian or whoever his name is, Santiago or whoever. And that's going to be important to them because now they're learning culture of another child. Because remember, all children aren't the same, right? We all do things differently. At this age, they're judged by their performance. How did they do well on their test? How is their writing? What is their report cards, right? They're out playing. It's, soccer. Are they playing it well? Now, Erickson, when it talks about school-age children, it is industry. Well, a sense of industry is what? And it's industry versus inferiority. So it's two ends of a spectrum. Their industry is what they can do well. There are kids who are good at math. There are kids who are good at writing. And there are kids who are good outside in playtime. They can kick the ball. They can hit the ball, right? Whatever they do well is their sense of industry. The inferiority is what they can't do well. I always wanted to write better than I could. And I always felt inferior to this other kid in school because she wrote better than me. And I always felt inferior with that. But I was good at ballet and tap, and I was great at spelling and math. But all of those industries that I was good at, I still remembered. I wanted to do something else better, and I couldn't. So progress now is the skill of writing to understanding now what they're doing. Initially they're just trying to write down, go, run, spot, run, those little sentences that they start, and they really don't know what they're meaning. As they start getting older, now they're understanding, like reading books that are more involved. Now they're getting to it. Now they do know that if they do well, they'll get a reward, but they don't need a reward every time they do something good, okay? And the one thing that as parents we need to teach them is that just because they couldn't do something one time, they need to try again. Because we don't want school-age children who feel inferior in many ways not to try again or get a fear for it. So as I said, Erickson is that stage of industry. What do I do well? And they shine when they do that well. Freud is talking about sexual latency, and this is same peer friends. That's part of that. Now, Piaget is now in concrete operations. They're starting to understand things. For instance, the concrete operations is take two glasses, a short, fat one, and take a tall, skinny one. And you take the fat one and pour it in the tall, skinny one, and it looks like it's more, right? It's still the same. That's what they're talking about. Or take a piece of clay, big round ball of it, and smush it into a flat. The big ball looked like more, but we know school-age children understand it's the same amount. That's what Piaget talks about. Now, physical growth. Now, you're talking ages 6 to 12. So they grow a lot during school age, but it is really slow. And then all of a sudden, prepubescent, usually age 10 for girls and 12 for boys, they have this prepubescent growth spurt. 25% of their height, it will go during these 2 to 3 years. They gain weight more and more rapid, then they increase their height. And their brains now are pretty big. It's not going to grow more. We know that they're more coordinated. That's why they're playing sports and they're playing Little League and soccer and all of these things. And they are more agile. Physical growth. Well, we know that preschoolers got all their baby teeth, right? So at age 6, we should start those baby teeth coming out. And now we're going to have our permanent teeth starting at age 6. So I am waiting for little Christian to lose his first tooth. He hasn't yet. He's 6.5. So we're waiting for the tooth fairy to come. But age 6 is when that happens. And by the end of school age, all their permanent teeth should be in. So 6 years is a lot of stuff happens. You know, we've talked about their GI tract when they're infants, and you're going to see food in their stool because they don't digest it well. Well, now at school age, it's more mature. Their stomachs can eat more, and their caloric needs decrease. They don't need as much because they're not having as much growth and as much weight on them until, of course, that pre-adolescent growth spurt. And of course, then they need more calories to go through that. Their infants, what was their heart rate? Wasn't it 140 to 160? That first 28 days of life, that neonatal period, it's called neonatal at that point. You know, their heart rate's 140 to 160.
Oh, 110 to 160. Is it a different one?
140 to 160 is your, that's the infant, that's up to 1 year. But
Okay.
that first 28 days, 140 to 160, normal, at rest, not crying, normal heart rate. Well,
Okay.
that heart becomes more efficient and it's grown a little bit. And now you only have a heartbeat that's going to be even less. It's normal for almost adult, heart rates at this age, 80 to 100, normal. One of the things that you have to think about, you have some young school age children that look old, right? They look like teenagers, maybe because they've matured quickly, or maybe they just they don't have a baby face like some of them. Remember, just what they look like does not make their brains be at the same place, okay? So their emotional maturity does not depend on looks. So always remember to find out where's their developmental level. Are they more mature, or how do you express and how do you teach these children to do stuff, okay? Gender identity, well, we know that at this point, the sex role development is influenced by your parents. Who do you, are your boys more aggressive and the girls not? Well, I had a family of 6 brothers, so I was a tomboy, but my mother made sure I had curls in my hair, dresses on and ribbons, but I was always that athlete out there running around in the mud, catching frogs, all that stuff, because that was influenced by my family, right? So then you have the school environment. So in school, they think boys should be, because they're boys, more aggressive than girls. It's just what it is, right? And we know that there are masculine and feminine attributes. You think of girls feminine, it's, the way they talk, speak, dress. Boys the same way. Now, in school, there's certain things that are required, what your teacher wants, right? Today, the amount of homework that comes home with kids is quite a bit. And if all of you who are parents and you see these packs of paper they come home with, especially the younger kids, it's quite incredible. So you have to really set realistic goals with that and to try to do it the best you can. It might be putting them in an aftercare in order to get the homework done, right? To help you, because especially you all who are students and working, and you got a young kid and has all of this homework, you have to have something to help, right? We know that children, it's important that they have good attendance, that they're on time, and it really helps with them with the socialization with other children, okay? We know that there are some kids who sits in the corner and they're lonely, just to make sure, because we think that things like depression and we think things like suicide, it's not school age, but don't think that, because children young do have what they feel is big things going on. So as nurses, we might identify that. And then homework, and responsibility should be responsibility of the child. A lot of parents sit down with them and make them do it, but it's the kid. Come home from school, change out of your uniform, have a snack, do your homework. And then you can go play your game or outside or whatever it is. But homework should be the responsibility of the child. Now, sexuality, right? Talking about sexuality with children, there's all these sort of slangs out there, and even these things are old comparative to what's there now. The one thing is if you don't understand a word a kid's saying, ask them, what do you mean? I mean, poor little Christian was, oh my gosh, oh my God, all the time, and I'm like, don't say that. Say, oh my goodness, please say, oh my goodness. But it's just part of what they do because they don't understand it. So letting them know what that stuff means. Now the 6-year-old, this is a energetic, get up, go, 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 as I call them. They love to be active. They are a person that if they're speaking to you, it's because they want to know something, and their vocabulary is getting bigger and bigger and bigger. He came out with aerodynamics as a word for swimming now. And I'm like, aerodynamics? Where did that come from? He said, I've got good aerodynamics in the underwater. And I'm like, okay, sure. You heard it somewhere. They still need a lot of sleep though. It's still at this age, they still need sleep, and they're gonna fight it. They will fight it. Boys and girls play together, but as they get older as school-age children, they're going to prefer to be with their same-sex peers. That is part of what Freud says, same-sex peers. They need time to adjust to school, and we need to understand when a kid is just getting frustrated, stressed, fatigued, and give them that time to relax with it. And we know that being in school, kids are going to cough on each other. They're going to be wiping their mucus everywhere. So we know that they're going to, again, be exchanging their germs, right? So making sure that the children know about washing their hands, using tissues, all that stuff. And again, immunizations, making sure they're up to date. 7-year-olds now are getting harder on themselves. They want to be more pleasing, okay? They want to please more. And that's the Kohlberg. I want to please. I want to please others. That's what they're looking to do. They have a great sense of humor. Now they're not going to be changing in their clothes or out of clothes or bathing in front of you anymore. They're going to close the door, lock it. Nope, get out. They don't want that. But they also want to be out running around. But they do enjoy times just being quiet times. So their understandings, well, they know seasons and months now. They know fall, summer, winter, even somebody born in Florida, like my grandson, he knows those things already. He is understanding math. He did the tens timetable out with chalk on my backyard because I have cement back there. And I'm like, the 10 times table. Okay. They love that, understanding it. Their hands are steadier, they're writing clearer, they enjoy playing, and they love being independent. They don't want people to help them. 8-year-old wants to do everything by themselves. Don't help me. Leave me alone. You take a shower, go in, lock the door. They come out and they're ready for bed or wherever they're going. They can play alone. They're very creative. They're coloring, whether it's music, could be even cooking as part of creativity. They love working together as groups. And these children are better when you take them out in groups. They're not going to be acting out like a younger child. And they're into hero worship, whoever that one could be. I remember talking about Mighty Mouse when I was this age. It was like Mickey Mouse, but it was Mighty Mouse who flew through the air. Here he comes to save the day. Well, I still remember that and writing a little paper about it. So whoever it is. Their arms and hands are growing faster than the rest of their body. Their muscles, again, are great, and they love sports. They love competition, and they like to argue, and they want their point made, and you better listen, right? They love to argue that way. So you need at this point, teaching parents and teaching the children that if they want to be upset, they have to know how to express that. So in an acceptable way. Now your 9-year-old is more responsible, more dependable. You can be sure that if you tell them what to do, they're going to do it. Because again, remember, they want to please. These are pleasers. They want to be a part of the family. They want that responsibility, like feeding the dog, feeding the cat, making their bed, putting their clothes away. They want to do that because they want to please. They want to please. You can tell them, oh, you did really good, but if you did this, it'd be better. They'll accept that better when they're younger. When you're younger, you can't do that. You have to just tell them what they did good. 9-year-old, again, hand and eye coordination is more well developed, and they're needing about 10 hours of sleep now, so a little bit less. Again, as I said, permanent teeth are coming in all through school age, and now they're more and more active in competitive sports. Remember, in sports, having proper safety equipment should be absolutely, reinforced, because safety equipment can save concussions and many other things. As I said, prepubescence or pre-adolescence is that 10-year-old. Usually the girls start first, right? Usually boys are 2 years behind girls in that pre-adolescent growth spurt and that maturity that's going on, and that puberty is going to be starting. The girls are more physically mature than boys. Again, I remember being in 5th grade, 10 years old, and thinking boys were stupid because they still acted like children, right? Like little kids. And I was becoming more mature. Of course, I'm still trying to be mature. They also want to be more independent at this point. They want to be able to make decisions and choices. And they like having a group that they want to be with and make ideas. And they think those are great when they all can decide to make those things. Also, they're starting to get, their same-sex peer friends, but sexual curiosity is starting to happen. Boys kissing girls or girls kissing girls or boys with whatever it is. They're starting to get curious. The 10-year-olds are more mature and poised and can tolerate things well. Again, they're using that slang words that are going on that they hear in school all the time. And they're identifying themselves with the skills of that being girl, whether it's They can put their hair up in braids, that they can cook well, whatever it is that they like to do. And they want to look good. They want the best shoes, the sneakers. They want to have, the glasses, whatever it is. Their personal appearance now is making a big deal. And we're starting now to understand more in depth cognition, as in what Piaget says, more abstract numbers. The 11 to 12-year-old, again, these children are intense, observant, and energetic, and they're going to see everything you do, and they're going to question everything. They're going to start. It's the start of almost being adolescents. They can be argumentative and meddlesome. Like if mom and dad are having a discussion, these kids might try to break in and try to, rationalize it out, because this is what they do. Remember, they are going into puberty. So its hormones are there also. And they need some freedoms, as in, instead of picking them up from the bus stop, having them walk home 2 blocks now, giving them some responsibility, letting them be more of an adult, as long as they know the rules and the guidelines. So the 11 to 12-year-olds, they say it's less concerned with their appearance and they seem to be preoccupied, but they still, at this point, they love to be in groups, whether it's the group that they play band with or art with, or maybe it's the book club or 4-H Girl Scouts, whatever it is, they like group. And they're starting to see they're getting hair in places, they're getting nipple buds and curves, and they're starting to see these signs of puberty going on.
I got a question about that, Ms. Bogart.
Sure.
It said that in the book that pre-adolescent girls look forward to their menstrual periods and wearing a bra. Who did they survey? Because
I did.
I did not.
It's like now I'm grown up. And then once my mom gave me the bra, I would come home from school and take the darn thing off. It was like, oh, it's terrible on me. And
though, like menstruation.
Well, it's because I didn't want to be different from other children.
Oh, okay.
You see, if my girlfriend already got it and I felt less than, because I didn't know really what it was. Now, I didn't have a mother who told me this stuff. I had a video from 1950s that was shown in the auditorium about menstruation, and I didn't know what that meant. It was showing the ovaries, and I didn't know it was about bleeding and pads and all that stuff. And it was like, I didn't know what I was looking for, or the cramps, or no, but that's a really, really good thing to think about. But I understand both ways, because once I had it, it was like, ugh, this is, I don't like this, and then can I go swimming? Can you wear a tampon as a 12-year-old? Putting a tampon in way back then, they didn't have nice little things. All right. So, you as being, younger than you have better products that could have been used. Me, it was like I had a pool in my backyard, and this is stopping me from swimming. And I didn't like that. So it ended up, I didn't want it. But when I got it, because I did want it. Funny. All right. They are, this is the one where you're talking to your child and they're looking at you, but they're not hearing a thing. They'll ignore constant verbal nagging, as in you can't tell them something and then repeat it 4 times, because after the first time, they tune out. But these children do need chores, as in put your clothes away and make your bed, or change your bed, or take the garbage out, or do the dishes, or whatever it is. It's really good. They need to start doing those things. Now, health supervision and health examinations. We know at age 12, a couple of things go on. And we know that then they need to go absolutely and start getting their HPV vaccines or whatever. That's part of it. I know as kindergartners, they need to go and get their immunizations and get checked up, making sure that they see well and hear well, so that there's nothing that's going to delay them in school because they can't hear or they can't see, and making sure their body all works the way it should. The younger kid, when they're sick, don't need to know the in-depth reasons what's going on. I mean, poor little Christian grew up in the age of COVID, and I know their family broke out with it 2, 3 times. I think it was 3 times. And he had to stay home from school. He said, "Oh, I just got a virus." But he couldn't come see Nana because Nana never got it, and he had to understand that it was a virus and it could make me sick. So that's all we could tell them. Children need time and a certain place to study. That's why getting them their own little desk or their own little corner or somewhere where they have their things, that is their schoolwork. That's when they need to do it. And that's their things here, and making sure that here's your pencils, here's your erasers, your colored pencils, paper, whatever. This has to last you for your school year. Make sure you take care of it, right? A lot of kids like to lose it, share it, not get it back, etc. But these children have to take responsibility for those sort of things. And also giving them some sort of allowance. Now, giving them allowance every week, I was in a family that they would give me a dollar for every AMI report card. Did I get an allowance for all the stuff I did every week? No. Some families will say that if you're good all week, then we'll go to the movies this weekend. As in, that's the allowance, if we can afford it, and was what I used to say. And now adolescence. You know what I say about adolescence? I mean, these kids have gone from a school age child to a child, and now they're becoming adults. And I call it's a roller coaster ride. Just hold on, hold tight, keep them close as you can. And in the end, these kids who are going to end up hating you, most of them in adolescence, will come back and love you even more because you held on. I was a single parent at the time, and I had a boy and a girl that were 17 months apart, the boy being bigger. So they were in the 9th and 10th grade, right? So I had to hold on. Now, what do we see with adolescents? Well, their secondary sex characteristics are coming up, as in they're getting breast buds, they're getting their periods. Tanner's has a whole big stage of it. We'll go into that. What does that mean? So what does it mean? It's the end with the cessation of growth and emotional security, maturity. These children start as kids and end up as adults at the end of adolescence. And we know that there are the early stages where they're still more like a kid, and then that middle age where they're learning how to be adults, and then of course the older stage where they're more like adults. Now Erickson talks about establishing an identity. Now, I think this is one of the big things that causes a lot of emotional distress on adolescents. Body image is huge. What if the kid's too fat, too skinny, too many pimples, too many curly hair, too this, too that, to the other? These kids can get depressed, and suicide is big on these children. So establishing an identity is big. And the other way of establishing an identity is, who's their sexual identity? Do they like girls? Do they like boys? Do they like both? What is that? Also, what am I going to be when I grow up? Because now you're starting to enter that stage where you are in school and you're planning for what your outcome after school is. Are you going to college? What am I going to be, right? More time away from parents and the family, and now we're starting to get into some sort of intimacy with whichever partner of the choice is what you want and get in your career. So it's rapid physical and physiologic changes. Again, they're growing 25% of their body weight. Their faces are becoming more mature, and all the baby fat's going away, and they're getting curves, etc. Right? We need to give them privacy, maintain that, and make sure that if we're doing procedures on these children, that we do maintain that for them. They are coping with a lot of stressors, with school and friends and just the community in general. And what we have to do and to teach our parents is to maintain an open communication, letting them talk to you about anything. So in case they're in trouble, they can come to you. It's a hard thing to get done because they usually talk to their, as I say, their buddies and them. They don't like to come to mommy because of maybe some things they're doing mommy wouldn't like, right? Or daddy not like. And they need to have positive health choices and lifestyle choices, not to pick up drugs and alcohol and cigarettes and, overeating, etc. All of these things could, we want them to be as healthy as possible. Now, they try to be more independent. They don't want mommy, daddy tell them what to do. They want to do what they want when they want, with no consequence. So it's very hard for especially ages that 13 to 15. They're just starting in the adolescence, getting along with mom and dad because their bodies are changing. The hormones are running wild, and they're having these sexual feelings that they don't know about. So it's very hard time of life. So Erickson, about the intimacy, again, body image, Piaget, these kids can figure out anything. For instance, let me give you a good abstract reasoning. So this kid wants to go this weekend to this party. He's going to figure out everything he has to do so mommy will let him go. And if the party is somewhere he shouldn't be, he might say he's going to go stay with his best friend, right? And the best friend is the one that they know mommy's not going to call that mommy, right? So now they can get to the party. So they are going to think of everything they have to do to get what they want. They can do it and do it really well. You got to be really careful with these kids because they're very smart. Freud, again, this is sexual, genital. This is all the hormones and the exploration of their genitals. So adolescents and girls, it's usually age 10, as I said, but up to age, and it's through about age 13. We know that it starts with the building of breast buds, and puberty comes along. And remember, puberty starts all those hormones, and all those hormones create things like hair and pimples and all of those things. So it's a great picture about everything that goes on here. I'm not going to go into all of them, but you can see everything on these bodies does change, from their breasts to their bellies, to their shapes, to their faces, the way they are, and to their genitals. Now the ages do vary. As I said, girls is usually age 10, boys are 12. And then those growth spurts occurs before age 18. Now, does it mean at age 18 that's the last time they'll grow? No, it doesn't mean that. I had a son who went to the Army at age 19 at 5'7". He came home 2 years later and he was 6'4". So it doesn't mean it's the end at 18. General appearance, because now they're getting long-legged, they're getting skinny, they're starting to look a little gawky and lanky, right? And it's just because they haven't grown into their bodies yet. Again, they do have pimples and they're full of grease and they need good hygiene. Again, hair is growing on the face, chest, axilla, and pubic areas. Now boys, their shoulders getting bigger, and now their voice goes down. Their genitals get bigger, their testicles get bigger, and they could have even nocturnal emissions during this time. And again, the one thing that girls does breast examinations, right? Boys should do it too. I saw an 18-year-old boy with a tumor in his testicle that he ended up having 2 more months of life because it had already metastasized due to a testicular tumor. So please making sure that we do tell parents to test the boys to test their testicles for any lumps and bumps. Pubertal changes occur usually over 2 years, but it can be 6 months that it happens. Again, what is it recognized by? It starts with the menstruation that starts. And again, with girls, they're starting to curve out those fats in the belly, and here is moving all over, and they're getting breasts. And again, nutrition is important on these children. We know that some children, especially if they're don't eat properly and they're almost to the point of anorexia, you will see menstruation delayed. So making sure that they're getting proper nutrition. Now, Tanner's talks about the stages of sexual maturity. As you can see, boys will start out with something really little, and in the end, they're full of hair and it's bigger, and the testicles are bigger. And the girls, you're going to start seeing the shape a little bit, but more the hair is there. What we see more in girls is the breast buds, and then we go to full grown, breasts. I listed it here and what that all looks like, something to go back and to look at. Now, as I said, psychosocial development, which is Erikson, again, it has to do with identity, and it has to do with intimacy, right? So again, identity, who am I? Also, again, it's body image, right? And then intimacy has to do with who you're testing and trying, and who you want to be with. The cultural and spiritual considerations, usually this is on the values of the family. And they either at this age decide to embrace it or not. Some children are forced to go to church every Sunday and they don't really want to. But, adolescents still have to do what parents say, mostly, right? Again, that body image, can I tell you anymore? It's all about trying to be accepted by their buddies and them, their peers. Are they in the group that's with straight A's? Are they in the band group, the art group, the rock group, the sports group? I mean, trying to be accepted, looking like what they want me to look like. Peer relationships help them feel belonged. And we know school is very important because this is where they find those peer relationships. Their close personal relationship is usually the peer of the same sex. Now, the one thing they say about your best friend as a teenager, very important thing that they have there, because how they treat that best friend is usually how they're going to treat their partner of life. So if they treat their best friend well, usually your partner in life is also going to be treated real well. And remember, always, 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 society and the people around them are going to be giving them all sorts of pressures to do this, that, and the other, and they've got to make good decisions. Now, Piaget, again, we're going to be able to think well, but again, we're going to start to be able to think more abstractly and how to really figure out how to get what they want when they want it. That's usually how they use Piaget at this time. They can see situations from many points of view. So they're going to start thinking about, okay, I want this. This is how you want me to be. So let me tell you this, and then I can go do what I want to do. That is part of what they do there. They do sympathize, they do empathize, they understand why they do stuff. And they also know that sometimes maybe it's religious or cultural, that sometimes people are different than each other, and they accept that. That's who that person is. Sexual behavior is just being acquainted with whoever your sexual partner is going to be. Dating is in groups, couples, single couples, and going out, going to movies together, going to parties together, or wherever. Sexual experimentation is usually because of peer pressure. My other girlfriend's already kissing somebody and I haven't, so let me go experiment, and all sorts of things can happen, which could be unplanned pregnancy or sexual transmitted diseases, right? And because many of these people don't realize that some sexual acts, even though they're not, complete penetration type things, can cause sexually transmitted diseases. So these children, adolescents, do need some good education with it, but they usually don't use as good protection as they could have. Now, teaching an adolescent about sex can be really hard. So remember, find out what the child knows, the adolescent knows first, and then again, teaching them what they need to know or what they ask. Now, we should always say abstinence, but we know if a girl is asking you about sex, they're sort of either already have or wanting to partake, right? And you tell them not to do it, not the answer they want. So as a nurse, what is our responsibility? Well, we can give them written and oral information, not our opinions, okay? But we know textbooks all say abstinence is what we do there. So giving them the information and then they can make their own decisions from there. We know that if we're teaching adolescents, it doesn't mean that they're going to go out and have sexual activity, okay? And it's been proven that they don't have a higher rate of sexual activity. Homosexuality is not uncommon in adolescence. There's a lot of experimentation going on, and that's okay. Children, adolescents, they need to find out who they are. Now, parenting the adolescents, hardest thing I've ever done. It's hard to let go and let them do what they want, but they still need some sort of boundaries, right? And the thing is to try to keep those lines of communication open and try to meet a compromise together. And I know it's very hard because parents want to say, you're going to do it the way I say it, and that's it. And that's going to make the adolescent do absolutely opposite because that's what adolescents do. So looking at these adolescents and teaching them how to take care of themselves. Now, we know that adolescents can become depressed and they can be suicidal. Body image, I don't like me, I'm depressed. I've lost my best friend. The guy I liked is now with my best friend. I'm alone, nobody loves me. Remember, looking at that and hearing certain clues, take it seriously, get them some help. Spending computer early hour in the morning, like nobody watching, find out what they're looking at, okay? They could be looking at some things that they shouldn't be. Remember, there's a lot of, sexual perverts out there who like to talk to young children. And adolescents are considered young children to do things that they normally wouldn't do. So parents need to be taught how to be aware of these things. And again, these long distance phone calls, who are they to, right? Who are you calling? Keep a track of it. Nutrition. Now you think that adolescents, there's not a problem. Well, you think about adolescents' body image. So I'm not going to eat good because I want to lose weight, because I want to be even skinnier, because I want to look really good, right? So nutrition's down, we're not going to be eating as well as we should. Take a bottle of water, power bar of some sort, go out for the day and you're done. Save your money because you want to do other things with it. I know that's even what my kids do. But remember, this is the age where they're growing, maturing very well. They do need good nutrition. They are not eating as good as they should. They're not getting their calcium, iron, and B12. So they need to be having good nutrition at this time. Now, vegetarian diets, there are some cultures that only have vegetarians. They don't eat meat. So making sure that they get enough of the iron, et cetera, that they need should be evaluated by a dietitian if they're in that hospital, right? If they're in sports, You know, they really need to be eating well. Um, the eliminating the caffeine and alcohol. You know, adolescents like to go out on the weekends and somebody finds a beer or wine or something, or mom's bottle of vodka, you know, and drink it. It happens. It shouldn't be, because now you're losing the water that these children need if they're going to be that sports person. And, you know, kids, again, body image, identity, want to be the best. And some of them have turned to anabolic steroids because they want to be the best. And again, anabolic steroids can affect bone growth, and in the future can affect their heart. As I said, there's a lot of oils going on through this puberty. They do need to bathe at minimum of once a day. These children love body piercings. My son came home with a pierced tongue. And I'm like, who let you do that? You're 16. And of course, he just wanted it there because he thought it was cool. And then it got infected. And then asked me to go out and get him medicine to clear it up, right? So these things do happen. I mean, how about the belly button piercing, the girls? Dental health. They really, really need to keep their teeth clean, and they need to floss to make sure we keep those teeth healthy. Sunbathing, they should wear some sort of sunscreen. Again, we know sun exposure can cause cancer. Motor vehicles, now they're starting to drive. Not only are motor vehicles generally one of our biggest things for injuries, but now the adolescents are driving them, making sure that they are prepared to drive and drive alone or with somebody else so that they're prepared. Another thing is you're going to have all of these kids going, you know, I live in South Florida, as I said, going to the beach, going to pools, making sure they know how to swim and to be careful with it. And again, those body contact sports, make sure they have the proper equipment to keep themselves safe. There is what we call a female athlete triad. It's a disordered eating, amenorrhea, and osteoporosis. As I said, eating disorders can cause the loss of your menses, right? So when you have a child, a female, who is not having her period, and let's say you notice they're not eating well and they're skinny, this is something that really needs to be looked at. Because again, nutrition is not being made, therefore they're going to end up with this osteoporosis. And again, it's good for muscle growth, et cetera, et cetera. And it helps, again, put the body back to the proper hormonal level so they can have their menses. Drug use. You know, many kids will just be smoking marijuana because, you know, everybody else does, or drinking because everybody else does. You know, remember to be aware of your child and what they're doing so they don't get to the point where they are in a severe addiction. When we see children, especially adolescents, are going in these really big mood swings, that is usually a clue that there is drug abuse there. So PACE, nursing you should assess for their parents, peers, and pot. A, alcohol, automobiles. C, cigarettes, and E, education. And vaping is huge, that they shouldn't be doing. Vaping has caused a lot of issues with cancers of the throat and even a lot of issues in the lungs. So these are things as nurses we should look out for, and again, that we should tell our parents about. A lot of times you'll see children, these adolescents, they're depressed and they use drugs as an outlet. If we're seeing kids that were good at school and now they're not, absolutely it needs to be looked at. It could be depression, and depression can, at this age, and it is real, suicide. Any type of call for help, saying that I just rather die than live like this, needs to be taken seriously and needs treatment now, not tomorrow, but now. So school nurses are very important. We're seeing that kid all of a sudden not looking the same, who is ended up, those grades are falling. This is something that a school nurse needs to take seriously and look for what's going on and have all the available information for these adolescents, and then again get in contact with their parents to make sure that they follow through. So adolescent pregnancy, we know it's real. Many children become mothers at this age. Again, remember, when we're working with adolescents who are pregnancy, we have to make sure that they're eating properly. You know, even during pregnancy, what sort of sexual activity are we keeping that baby safe? Are they getting the prenatal care they can get? All of these things are really important. And again, as a school nurse, this is something we can work with. So there are trimesters, right? We know there's first, second, and third, but you know, as an adolescent, initially you find out you're pregnant, but you don't understand what's going on yet. And then all of a sudden you start feeling this flutter or something in your belly. And now you know this baby's coming. And then we need to prepare that adolescent for that newborn and that birth process. So with adolescents, open that line of communication. If I'm here seeing them, they're listening to music, I'm going to ask them what the music is. If I see that they've got these cool sneakers on by whatever brand, I'm going to ask them, gee, what sort of sneakers are those? Those are cool. Or what are you doing in school? What do you like to do? What do you want to be when you grow up? I'm going to open a line of communication. I'm going to make them feel comfortable. I'm going to, if I need to speak to that adolescent about sexual things or whatever, I'm going to have the parents step out and I'm going to talk to them alone. And I'm going to let them know I'm going to keep their conversation confidential. Unless what they're telling me is going to hurt themselves or others. It's the only time I have to tell anybody about it. But at least I can find out what they're going through as a nurse. And as a nurse, you can make a big difference in an adolescent's life. You know, sometimes adolescents are angry and hostile and they don't know why, because they're afraid for whatever reason. That rebellion is because they just want to do what they want to do. And again, parents should be guided just to listen, understand, share, and make some sort of compromise together. So health teaching, nutrition, dental, personal care, body piercing, accident, substance abuse, self-control, risk-taking, money and time management. Some of these kids have some money, making sure they just don't blow it on, you know, silly things to keep it for what they really need. And again, those open-ended questions are always good speaking with them. So there's a couple things that I say. The act of eating, texting, and watching TV with an open textbook nearby. I mean, that's what you call super multitasking, right? Many of them do. So a lot of information. Now I've just got a short Kahoot, only like 17. We're going to do that. And then we'll be done for today. Any questions? Camelia, are you with me? I just see your fan.
Yes.
Okay, because I can't see you. If I can't see you, I don't know you're there. Thank you. Here we go. So go to kahoot.it, pin number 383-2259. I need more people. Anybody else coming?
I'm trying, but I keep having issues with
Yeah,
Kahoot.
okay. I probably won't be there either because I cannot figure this out. So
I'm on the Kahoot website, but I can never get in, and it keeps saying other
If if
errors. This
if
happened.
you if you go to Kahoot.it,
Yeah.
and then it will just say enter the PIN number. All
okay,
right, we'll
one
just
minute.
keep going.
Your phone on there, like next to the numbers, you can just scan with your camera. It will take you there.
Well, look at that. Thank you. You know, I never knew that. See, I learned something today. Life is good. Thank you so much. Wow. And I've noticed it there. Let's just get going. Thank you. Week 2 Kahoot. A preschool child is asked, why do trees have leaves? Which response would be an example of animism. What does that animism mean? Remember the stick, riding it like a horsey, putting the hands out, flying like a plane, those sort of things? So to hide behind when they are scared, right? So these are different things where the imagination goes, where you're using something for something else. It's that creative mind, that magical thinking that goes on. What task would be appropriate to expect a 5-year-old child to do? You know something, I need to be teaching Christian how to make the table. That's what I really need to have them. Now, do we want them carrying glasses? Glasses could break. So that's why that's not the answer. Maybe one at a time, but remember, glasses can break, so you can't trust them completely yet. But paper plates, sure, let's use them. But dealing with knives, oh my goodness, not yet. A father's concerned about how long his preschool child will continue sucking his thumb. What is the best response? So 5 years old, 3 years old, 3 to 6 years old, sucking a thumb. So remember, usually it comes out before school age, hopefully. Now, if it doesn't, then it can cause the teeth to be damaged and require braces, okay? I know that was a tricky question. What should the nurse suggest as the most appropriate toy choice for a 3-year-old? So 3-year-old loves, especially if it's a boy, wants to have, the big, toys and trucks, and they love playing with those things. It's just all that magical part of building something. They're not ready to take care of a pet yet. Board game is still too old for that kid. They're not able to even just play that little pop it up trouble type thing yet, or checkers, no. And a push pull toy, that's more of a toddler. What fear is unique to a preschool period? Bodily harm. They're afraid their fingers or something are caught off. As they get older, it's death, okay? And as they get older, actually younger, it's those animals, those big dogs they don't like. They're gonna chew them or something. When planning an activity for a 3-year-old child, the nurse bases the plan on the average attention span of how many minutes? 3-year-old, how many minutes is an attention span? So it's about 15 minutes. They can sit and they can do something. Remember, we're preparing that child to go to school, right? Preschool, and then we're sending them to kindergarten. So 15 minutes is about as long as they'll sit there for. And actually, that's quite a bit. A 4-year-old child says he has more money with a nickel than his father has with a dime. Per Piaget, why is that true? You know, it's intuition. And the reason is the nickel is bigger in size and the dime is smaller. So he thinks the nickel is more money. That's the way they think at that age. What should the nurse keep in mind when planning to teach a class on nutrition to 4th grade students? So these are about 9 years old. You know, abstract is your adolescents, egocentric is your toddlers, okay? And school age is where they're thinking logically and that concrete. It's about the volume of water in the thin, tall glass, the short glass, the amount of clay in a ball versus flat. They are logical and now they can understand and be able to understand about nutrition. An 8-year-old child has frequent nightmares and the parents are concerned. What is the nurse's best response? You know, when you're having a child who's having nightmares, it's what their fears are coming to light in their brain. It's almost called night fears, that they go through. So it is a normal extension of the fears of mutilation and what they're feeling, during the day. And it comes out at night. Night terror. A 10-year-old girl likes school, plays the flute, and plays tennis. What do these activities help develop? So she likes it. So she's good at something. What is that? What does Erickson say? School-age child. Something you do well. A task you do well is called what? That's your industry. Identity or adolescence. Remember body image. What do I look like? Adolescence. Looking pretty. Adolescence. Industry. What do I do well as a school age? And the inferiority is the other part of industry. What I can't do well. What statement by an 11-year-old child leads the nurse to determine he has moved from the mindset of egocentrism? Means all about me, mine, right? That's all about egocentric. So it's all about worried about somebody else. Remember, ego is about me. So when you say that they moved away from that, means you're worried about other people and other people's feelings. The school nurse is preserving a tooth that was knocked out. What will the nurse be especially careful to do? A lot of times kids are playing and a whole tooth will come out of their mouth. Now, these are permanent teeth. So how can I get that tooth put back in? I've got to take care of that tooth well right now. So you're only going to hold the top of the tooth. And now what are you going to do? You put it in cold milk. Cold milk will keep that tooth preserved so that it can go back in the mouth and they can reimplant it. And I've seen front teeth, bottom teeth done very well They numb it, and the dentist comes in and pushes it back in. And these kids do well, and then you don't have to get like a stem and false tooth, and those are expensive. A nurse is assessing a 13-year-old boy, which physical change indicates the male puberty has begun. What's the first thing that happens? Well, girls, it's breast buds. In boys, it's testicle enlargement, okay? Girls, it's breast buds, according to Tanner, and in boys, it's the enlargement of testicles. A parent comments that her adolescent daughter seems to be daydreaming a lot. What does this behavior indicate? What she's doing is she's thinking, preparing herself for what's going on out there. And that's exactly it. The nurse is planning the care of an adolescent. What psychosocial task is most important for the adolescent? According to Erickson, which one is that? When you talk about adolescent, it's their self, it's their identity, it's their body image. Good job. School-age children is industry. What can the nurse suggest as a good dietary source of zinc for an adolescent who is a vegetarian? And nuts. Believe it or not, nuts. Citrus fruits are more vitamin C. Green leafy is more iron, okay? But nuts is zinc. And last question. A girl tells the nurse, I love Katy Perry and I want to be a singer. This statement is typical of what stage? And that's usually the young adolescent. They see something they want to be, and they're going to go try to get it. And as they go through the middle and the late stages, they realize what they need to do in order to prepare for their future as adults. Number 3. Number 2. Number 1. Shabrea. Good job. And Chanel and Kay. Okay, guys, it's been another good class. Remember, next week are the reviews for the exam. It has been shown, you go to a review, you're going to be doing better on the exams. I have sent you a worksheet where you can fill in what you need, okay? After you get the reviews, I send you the PowerPoint so you have it there to match it up to, okay? And it follows the same thing as the PowerPoint. So it is a great tool, study guide for your exam, okay? Any questions, anything you need, just holler, send me a message, and I'll get back to you. Thank you, guys.
Miss Bogart,
Yes.
after all the